My name is Shanine and this is my partner Jingro. Today, I'm here to give a talk about good health and well-being. So, what is good health and well-being? Good health and well-being is a state of being which involves in physical, mental, and social aspect of a person's life. Poor good health and well-being will increase the risk of getting chronic disease. Hence, we are here to raise awareness about chronic disease among the youth and adults.
First, let's discuss the diabetes prevalence in Malaysia is projected to rise from around 17% in 2019 to 20% by 2024. It's highlight a growing health crisis. To manage this, patients must follow strict dietary guidelines and regular check blood glucose level to control this disease and prevent complications. Next, look at this data from Global Cancer Observatory revealing a heavy cancer burden in Malaysia, with 155,000 plus prevalent cases over 5 years, and cancer patients often suffer pain and discomfort as well as hair loss and skin changes due to the treatment, and this highlights the importance of early detection and support care to improve quality of life.
What is chronic disease? Chronic disease is a long-lasting condition which usually can be controlled but cannot be cured. For example, cancer and diabetes, they are both considered as a physical health issues in chronic disease. The symptoms can only be reduced but cannot be fully removed during the therapy. On the other hand, Duke studies also suggested that mental health problem could also be a type of chronic disease, such as depression, bipolar disorder, and any other types of mental illness. So next, we can move on to the cause of chronic disease. What causes chronic disease? Firstly, lack of exercise will increase the risk of us getting chronic disease. This is because exercise will boost up our metabolism, which can prevent diseases. The second factor is stress. Too much stress will weaken down our immune system and make our body more susceptible to the infection and diseases. The third factor is genetic factors. Genetic factors will increase the chance of us getting chronic disease. Last but not least, unhealthy lifestyle can also increase the risk of us getting chronic disease, such as smoking, excessive consumption of alcohol, and etc. So, how does chronic disease affect our daily life? In one study, they had collected the data from different types of chronic disease patients. 66% of the patients experienced negative outcome in their life situation. This really affected their point of view towards their life, since they doesn't know when will them be fully recovered. Only 8% reported a positive review in their life situation. Besides that, their physical emotion also affected. They often feel sad, despair, and also incomprehension over the time.
And now let's talk about the strategies. Do you know that engaging in physical activity can significantly reduce the risk of chronic diseases? According to the World Health Organization, the adult who aged 18 years old and older should exercise at least 150 to 300 minutes of physical activity each week. If you don't have a gym membership, no worries, a brisk walk, a jog, or even dancing around your living room can make a huge difference. And moving now, build your strength, resilience, and create a buffer against your illness in the future. And second, we know that regular health checkups are also important. They help us to catch potential problems early, as many health issues develop silently without any symptoms. According to the medical guidelines, individuals who age 19 to 21 should check up every 2 to 3 years, and those who age 22 to 64 every 1 to 3 years. And people who over 65 should check up annually. By prioritizing this visit, you take proactive steps to ensure your health and address any concern before they become serious. Finally, we can reflect on our health. Let's consider what Ann Wilson Shipp said, that good health is not something we can buy. However, it can be an extremely valuable saving account. Additionally, Jerry Dunn also said that don't limit your challenges, challenge your limits. Therefore, we should prioritize our health and be responsible for our life. And this is our reference list. Thank you for your listening.